Today we are having the second meeting of the Illawarra Shoalhaven Regional Health and Aged Care Taskforce. The Taskforce brings together stakeholders from the very highest levels across a wide range of sectors and all layers of government to discuss solutions to the current bed block crisis.
We have too many people in hospital each night that should be in residential aged care.
I think one of the nice things of the task force is it is a group of people both at the local level, the state and the federal level, looking for solutions that are tangible, that are real and can be implemented. So it's not just a theoretical process. That being said, it's also a wicked problem for this region and others.
Community Industry Group has spent the last 12 months researching the bed block issue.
We did research looking at all of the people who went to residential aged care from hospitals in the Illawarra last year. 96% start their journey to aged care in an ambulance, going to the emergency department, and on average people are in hospital for 66 days before they finally get to residential care. At the personal level, the cost for that older person, hospital's the worst place to be, but to be there for an average of 9.5 weeks before going to residential aged care is really where nobody wants to spend precious time towards the end of their life.
One of the things that we're doing is we're looking at our own internal processes about people prior to coming to ED, what happens with people in ED, what happens with their patient's journey through the hospital, and how we can actually improve that process.
And the impact's twofold. On an average day now, 200 beds a day in our region are occupied by patients on their way to aged care. That's 20% of all our public hospital beds. So at the system level, all those patients are sitting in medical beds and the medical patients are sitting in surgical beds and surgery's getting cancelled.
Look, I think what really came across is the awareness across the sector of the degree of the demand and supply issues for aged care here.
We need about 1,000 more aged care beds in this region, and we need to get them online as soon as we can, and that means we're going to have to be much smarter about innovative ways of raising money for capital and new building standards and all those sorts of things.
Look, I think we've got a situation, while we've got some immediate short-term pressures, if we're not going to have this repeated in the next decade ahead, as older stock comes off in the Illawarra, we've got to make sure that we're investing above and beyond that so that we're getting a net increase in supply. We've got a growing population, we've got an ageing population. If we're going to take pressure, we need to take pressure off all parts of the system.
We have to make sure that we really are supporting older people to live safely at home and try and reduce demand for residential care as much as possible.
One of the most important things for us to be concentrating on as in-home providers is the amount of people who are living alone at home and the risk factors that are associated with people who are older and living at home, given that they're 60% more likely to present at hospital.
The first cohort of baby boomers turn 80 in Australia in 2025. And this is going to only get worse for the next 20 years unless we can come up with a system that safely and in a seamless way deals with people at home in a much better way, into hospital when they need that in a much better way, and then to get the aged care they need in a much smoother, streamlined way.
Today we presented a version of our final first year report for everybody, and the report includes a series of recommendations. We've asked Taskforce members to sign the recommendations, to endorse them, and help build our voice for lobbying and advocacy for those solutions.
It's great today you're not working in isolation, but collaboratively, that's how this issue can be addressed.
I think it's a willingness of all of us to talk about solutions where we do combine our strengths.
And there were lots of ideas, and there are some things we haven't yet tested, and there's a lot of potential options and solutions we'll be pursuing following this task force meeting.
I love to see people working together, but also how everyone had solutions to put on the table, and not any of them are easy solutions, but they're workable solutions, I think, if we do work together.
It was significant for me because I was a participant, but apart from everybody else, they were all working in the aged care system. I'm an advocate, but it meant that I gained a lot more detailed information about what's going on, which means that I can take that to the Council of Elders and ask for more help for the region.
I think I was really encouraged by different levels of government making a commitment to the issue.
Today, the New South Wales Government committed $100,000 for the remainder of this financial year, $300,000 more for next financial year to continue the community industry groups' work around working with the Commonwealth, working with the state and working with local council to try and work through a big challenge, increase supply, get older patients out of our hospitals and into better care situations that's great for them, great for their family and a lot better for the healthcare system.
You can learn more at the Community Industry Group website. Check out the links in the video description or post.